Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. Subscribe at kevinmd.com/podcast. Today, we have a special sponsored episode from Mag Mutual. We welcome William Koenigk. He's an emergency physician and currently the executive chairperson of Mag Mutual Insurance Company. We explore how physicians can navigate unexpected medical outcomes while preserving trust with their patients. Through Dr. Koenig's clinical and leadership experience, the conversation examines common challenges, practical approaches, and the role of structured support programs like the PRESERVE program. The discussion also looks ahead to how the healthcare industry can continue evolving to better support physicians in maintaining strong patient relationships. Find out more at magmutual.com. That's magmutual.com. The link will be in the show notes. Bill, welcome to the show.
Kevin, thank you so much. It's a pleasure to be here on your esteemed program. Thank you.
All right, so let's start by briefly sharing your story and journey.
Sure, I'd be happy to. And I'm going to warn you right off the bat, Kevin. I went to law school before I went to medical school, so I can talk a long time. So, in the interest of your audience, please feel free to cut me off at any time. So, I graduated from college, and I did go to law school, and I'm a member of the bar in North Carolina, but really decided that wasn't my calling, and ended up going to medical school in Virginia. I did my residency in emergency medicine at University of Virginia, and practiced emergency medicine in South Carolina for about 15 years. While I was there, I started working for Mag Mutual, which is an insurer of physicians and hospitals. I started consulting with their claims department on claims that were made against their insured physicians and hospitals. Enjoyed the company so much and thought the mission was so wonderful that I ended up joining full time about 8 years ago. I was the chief medical officer here for about 4 years. And then about 4 years ago, the board of directors asked me to become the executive chair of the board. So I've been doing that for about 4 years now. It's different from clinical practice. Instead of seeing a few patients a day, I feel like I now take care of tens of thousands of doctors a day. So it's been a wonderful journey for me.
All right, wonderful. So let's jump into the first section of our show today, challenges in supporting the patient-physician relationship. Bill, what are some of the biggest challenges physicians face when trying to maintain trust with patients after an unexpected medical outcome?
Kevin, I think we're fortunate in that we're in a profession where trust is kind of built in. I think in general, while the numbers may go up and down, in general, people trust physicians. We enjoy that. And I think one of the hardest challenges, one of the biggest challenges is expectations.
Mm-hmm.
I think we don't, as physicians generally, we don't give guarantees about outcomes, but I think nonetheless, there's this sort of tacit understanding that patients have that things are going to turn out, and they don't always turn out the best way, right? And so I think to a certain extent, one of the biggest challenges is addressing those expectations. We always want to meet our patients' expectations because they're generally aligned with our own, but sometimes they don't. And one of those times is when you have an unexpected outcome. And I think in general, we have to talk to patients about, hey, I know your expectations were here,
Mm-hmm.
and I know this happened. Let me bridge those two things and try to, keep that trust between us. Let me explain why I think something happened that wasn't what you or I expected to happen.
Why do you think some physicians hesitate to disclose adverse outcomes or express concern even when they want to?
Well, I think there's a lot of fear around that. I think there's the fear of the legal ramifications. Hey, what if I say something that's wrong or that implicates me of doing something bad? I think there's a reputational worry, right? Hey, if I admit I've done something wrong and this gets out, does that mean my colleagues won't refer patients to me anymore? Does that mean this patient won't come back to me anymore? I think also, Kevin, as you know, medical care is becoming so much more consolidated. The last number I saw was that 80% of physicians are now employed by hospitals or private firms of some sort. Hey, if I start admitting, that something didn't go exactly the way it wanted, is my employer going to think that I'm not a very good physician? Could I lose my job? Could somebody complain to a medical board? So I think there's a lot of fear out there. And listen, some of it's founded. We can talk about that, but I think there's a lot of fear around this whole idea of disclosing that something's gone wrong, and let's talk about it.
So you specifically mentioned the fear of litigation and the fear of reputational damage. How does that fear affect the way physicians handle these situations?
Yeah, I think, for generations past, our parents' generations, I think the way those fears affect them is just to clam up. Hey, let's put up the wall. Something's gone wrong. I'm just gonna not. Maybe it'll go away. Let's just not discuss it. And I think those fears it fed into that. And I think I think that's changing
Hmm.
slowly. I think it's difficult, but I think those fears of the reputational, economic, legal, possible ramifications really have caused in years past physicians to shut down when it comes to talking about unexpected outcomes.
And in your experience, what misconceptions do patients often have about medical errors or unexpected outcomes?
Well, I think the biggest misconception, and good Lord, we feed patients this all the time, whether it's through popular culture or us talking to them. But they see medical shows where miracles
Yeah.
happen every week in a 60-minute episode, and they expect, again, going back to expectations. The expectation is things always turn out right.
Hmm.
As physicians, we know that that's not always the case. If you're the best gastroenterologist in the world, you can do 1,000 colonoscopies just right. You're still going to have complications. I don't know exactly what the rate is, 1%, 2%, but
Hmm.
things go wrong. And I think a misconception amongst patients is that things always go right, when you and I know they don't always go as expected.
The next section we're going to talk about is solutions and programmatic support. So, Bill, how can structured programs or approaches help physicians navigate these difficult moments more confidently?
Yeah, I think the number one way is what you said, structured. I think it's just giving physicians this rubric they can use to go through and say, hey, this is what this looks like. It starts here, talk, do this, do this, do this. We're so comfortable, when that middle-aged male with chest pain walks in the emergency department or our office or the cath lab. We're so comfortable with the approach. I mean, every one of those patients is different, right? But we know the approach to that. I think a structured approach to talking about unexpected outcomes does the same thing. It
Hmm.
gives us that confidence. Hey, I know how to approach this. Every case is different, yes, but I know how to approach each case with confidence.
MagMutual's Preserve program offers support for both communication and financial reimbursement. How do these components work together to help preserve the patient relationship?
Yeah, really good question. And I think really important. And I think both those things by themselves are important, right? When something goes not as expected, the communication part's important. And there, financially, it could be important, right?
Hmm.
Sometimes that unexpected outcome requires further surgery, further care, further therapy. And each of those by themselves is good, but working together is so much more powerful. So think back, a couple decades ago, there was this big push about, Sorry Works. I think that's a really powerful program. And I still believe in that, in saying, showing empathy and saying, I'm sorry. But at the end of the day, the patient, going back to my colonoscopy example, hey, doc, I appreciate your explaining this and saying sorry. I still got to pay this surgeon over here to fix my colon.
Hmm.
How do you help with that? And I think the financial part comes in because it kind of closes that loop. The communication part explains what happened and what we're going to do to help fix your problem. The financial part comes in and says, hey, you're not going to be out of pocket. You're not going to be down because this unexpected outcome happened. We're going to take care of both those things. So they really work together to make a more powerful approach to addressing unexpected outcomes. And that is the nub of the Preserve program. It's those dual prongs, the communication part and the financial part when needed.
Can you give us some examples of what kind of impact you have seen from the program, either in terms of the patient response or physician experience?
Yeah, both. I think first and foremost, patient response. I think, in America today, so many people live paycheck to paycheck. Our
Yeah.
patients are no different. Paycheck, not every patient, but a lot of patients are living paycheck to paycheck. All of a sudden, they've got this additional bill that they weren't expecting, they didn't budget for, that maybe insurance doesn't cover. So many patients have come to us after the Preserve program and saying, hey, really appreciate the communication, but also really appreciate that I wasn't out of pocket any money for this to take care of this. So that's really how, that's one way it really affects patients. Physicians too, going back, you mentioned the structured approach to talking about unexpected outcomes. Many physicians, myself included, came through medical school and residency without a good idea of how to talk about when things just don't go exactly as planned. We get physicians coming back to us all the time saying, Thank you so much for educating me. Now, the next time this happens, I'll know how to approach this situation, because this was never addressed in my education. But it should have been. We're all going to experience unexpected outcomes, no matter how good a physician you are. We're going to have that. We need that in our tool belt to say, how do I address this with the patient?
And then we're going to talk about more specifics of that approach and advice for physicians later on in the program. But before we do that, are there any other resources or tools that you think would strengthen the physician-patient relationship after an adverse event?
Well, I think the communication is important. I think the other thing is just giving resources. And we could talk about this, when we talk about, how we approach this. But I think it's so important that I think a good analogy is, say, informed consent. Informed consent isn't sort of a one and done kind of thing. People may have questions the next day. This is the same thing, right? It's not a one-time event. Inevitably, when you're talking to a patient, whether it's about an unexpected outcome or about your plan to deal with their chest pain, I figure they're hearing about 50% of what you're saying. Maybe they're comprehending, if we're lucky, 30%. You need to give patients that opportunity to come back to you and say, hey, I appreciate the time you spent. I've got a couple follow-up questions. And make sure we don't just shut off patients and saying this is a one-time event. And I think that's the resources we need. We need to build it into our practice. And I know we're all busy. We've got so many patients, but we need to build that into our practice to allow patients to come back with those follow-up questions.
You're listening to a special sponsored episode from Mag Mutual. We're talking to Dr. William Koenig, emergency physician and executive chairperson at Mag Mutual. We're exploring how physicians can navigate unexpected medical outcomes while preserving trust with their patients. Find out more at magmutual.com. That's magmutual.com. The link will be in the show notes. William, we're going to talk about practical advice you can share with physicians. What advice would you give to a physician who's unsure how to approach a conversation after an unexpected outcome?
I love this. Practical advice is where the rubber meets the road, right?
Yeah.
Listen, I think it's important. I learned about the Krebs cycle, but it was more important that I learned how to deal with diabetic patients in the emergency department. Communication's the same way. It's easy to say, let's communicate all this stuff, but what does that really look like? So I appreciate that question. First and foremost, I would say preparation in advance. If you're going to have a conversation that could be difficult, and by difficult, I mean it could be difficult for you to explain what went on. It could be difficult for the patient to hear. But whenever you're going to have one of these difficult conversations, prepare. Review the patient's case. You've probably had patients like this before. You may have had a complication like this before. What were the questions you've dealt with before? Anticipating those questions and how you'll answer them is huge. I think being honest and transparent. And I think part of that is honestly saying, I don't know. You may be asked some questions where you don't know the answer. It's fine to say, I don't know. And I think at the end of the day, that's a much better answer than trying to speculate. I think speculating doesn't help the patient. It doesn't help you. I think just staying honest is important. I think showing empathy. Again, the expectation wasn't met, your expectation or the patient's. Let the patient know that, you understand that this isn't the easiest day for them. Kevin, I think taking responsibility is important. I think you start, pointing fingers. That doesn't really help anybody. I think when it's appropriate, we need to be able to say, that's on me. This was my job, this part of it, it didn't turn out the way I expected. That's my responsibility. I think while you're having these conversations, one thing you can do is, what's commonly called active listening, which I think just means listening, sincerely, right? Listen to what your patient's telling you. Listen to what they're asking you. And if you can avoid those issues, please do. I strongly advise, it's so easy for us as physicians to slip into medical jargon, medical acronyms. Kevin, that's the way you and I are used to talking to each other and our colleagues. It is not the way our patients will understand what they're going through. So I always advise to avoid that. Discuss next steps. Going back to the colonoscopy example. Okay, you've got a perf colon. Here's your condition. Here's what I suggest are our next steps. I've talked to these colleagues. Let me map out to you what I think the next hours, days, and weeks look like for you in your medical care. I think offering support and follow-up is really important. When I spoke to patients, in the emergency department and they had an ongoing issue, I always tried to give them a phone number, somebody to call. Here's your pressure relief valve. If you don't know where to go next, I need you to call this number and somebody's going to answer and help you navigate through this. But I think all that, the higher level and everything I've just described goes to, approaching this with honesty, empathy, and a commitment to doing what's best with your patient. I think that's what we all want to do. But I think when it comes to these communications, keep those at the forefront. You're going to be fine in these communications.
I think one thing that struck me is those words, I don't know. And as physicians, right, we're just not often trained in showing that vulnerability and showing that transparency with patients. So I think what you said was tremendously powerful. Now, how can physicians balance the need for honesty with the risk of saying something that might later be misinterpreted legally?
Sure. No, I get that. And I think part of it is, we talked about not speculating. I always worry about that somewhere down the road. Well, doc, you said if you had done this, things would have turned out. Well, the fact is, we don't know about that. I think, you do want to balance those things out. You want to be honest and you want to be transparent. You don't want to say things that, you can't back up. I think the balance, I always tend toward a little bit of, I want to tip the scales in favor of over communicating. That's for sure. So I think you want to balance those things. And as far as, what's going to be interpreted down the road legally, I think when you have these discussions with patients, you want to document what the discussion was. And I think in that documentation, you want to put, hey, here were the questions. Here's what I explained. If something were to come up down the road, your insurance company like Mag Mutual, if you have a lawyer who's representing you, can refer back to that and say, oh, doc, I really appreciate your documenting this. I understand the spirit you went into this. I understand things may have been misinterpreted. And so, if you're worried about that, make sure you document well, not every word that's said, but the spirit in which you had that discussion.
You earlier mentioned peer support, and I think that's tremendously important because I've had guests on this podcast talk about how isolating it is for physicians who may be going through an adverse event, and they're often advised not to talk about the case with anybody else, right? So tell us more about the role of peer support or mentorship programs and how that helps physicians build confidence in these conversations.
Yeah, and I think there was a time in medicine where we all had to be, we're brick walls. We're not going to show emotion. We're going to be strong. The fact of the matter is we're all human beings, and I think as physicians, a lot of our self-image and our self-worth is wrapped up in our profession. Something doesn't turn out the way we want. Some self-doubt can creep in there, right? And it affects us all differently. We certainly see that when people are going through litigation. Litigation affects everybody because there is that self-doubt. Yeah. I think it's important that you have that peer support group. Do you have the mentor who's been doing what you've been doing for a long time? Those peers that are on your level, and don't underestimate the importance of family and friends. I think sometimes we're worried. I talked about employers, worrying about our reputation. We worry about our spouses and our kids. Are they going to think we're different physicians that are not as good? But I think if you try to keep that stuff all inside, Kevin, it just festers in there and nothing good happens. So I think, peer relationships, mentor relationships, family relationships, those are something you want to be cultivating every day. When you do have the unexpected outcome in that conversation with the patient, that's not the day you want to go out and look for a mentor. Hopefully you have a mentor in place, long before that. One of the nice things I think about medical school and residency, and listen, everybody's got some criticism of it, and sure, we could always do things better, but the way it's set up, you're learning in sort of a hierarchical construct, which lends itself to developing those mentorship relationships. And I would encourage, if there are younger folks, watching this, take advantage of that construct and reach out to the folks that you respect as physicians and make them your peers and mentors when you need them for something like this.
We're going to move now into the last section of our conversation today, looking ahead, and we're going to talk about industry and cultural shifts. So, William, how do you see the healthcare industry evolving in terms of supporting physicians through emotionally complex patient interactions?
Yeah, we touched on earlier, Kevin, just the consolidation in healthcare and how physicians they're more employed situations as opposed to partnership. Groups are getting much larger now. That's a discussion for another day. Neither you nor I chose that. That's just market forces. But there are a lot of silver linings to that. One of them is resources. As physicians get in groups that are much larger, their risk management resources, their peer support resources, patient resources are much richer and more vibrant. And we're seeing that in these bigger groups. And I think that, I think these larger organizations understand the importance of I'm going to use a word we don't like hearing as physicians, but customer satisfaction. At the end of
Hmm.
the day, they are our patients. They're also our customers, and we want them to be satisfied. And part of that is to start this process of more open, honest communication. I think people from the business world and the financial world, they understand the importance of that more. So I think that's a cultural shift we'll see as we sort of congregate into these
Hmm.
larger and larger groups with more and more resources.
So you talk about cultural shifts. So what are examples of these cultural shifts within medicine or society do you think are needed to normalize open communication after adverse events?
Look, I think just, one of them is that the fallibility of physicians.
Yeah.
We are, none of us are perfect, and we all want our doctor to be perfect, just like I want my Delta airline pilot to be perfect too. But we all, make mistakes, and I think there is this cultural shift now that we realize that doctors, while I think for the vast most part are so well intentioned and are so well educated and so dedicated to doing what they want to do, and yet things still sometimes aren't going to turn out the way that we plan. I think that's a shift that's happening. Now, you could ask me for data to demonstrate that, and I don't have it, Kevin. But we also insure tens of thousands of physicians. And when I go out there and talk to them, I definitely get that feel now. And listen, part of that is out of necessity. Medical information is so much more accessible to patients now, through the internet. There's some good information out there, there's some bad information. But again, I see physicians as the ultimate navigator of
Hmm.
all of that information. And so, we've got to communicate better. We've got to have this cultural shift that says physicians can make errors. It happens. Things don't turn out the way it's planned. And when that does happen, there's going to be this much more open willingness to discuss that and what happened, why it happened,
Hmm.
why I'm not going to let it happen again, and what's going to happen for you next, Mr. Patient.
If you could change one thing about how physicians are trained or supported in this area, what would it be?
Well, it would be an earlier addressing of this issue in medical school and residency. And I get it. Medical school and residency is so thick. There's so much medicine to learn, and we
Yeah.
want to learn to become good doctors, right? But this is part of it. In my residency, I didn't really get much education, if at all, on errors and how we deal with errors, how we deal with unexpected outcomes. I didn't get much education on medical malpractice insurance. I didn't get much education on how you run a practice. All those things are important. And so, we do ask, residency to do so much. But if there's one thing I could change, it would be a carve out in that time, because I think this is that important to address it within residency.
Do you think patients today expect different levels of transparency and communication than they did 10 or 20 years ago?
I think so. And I think that also goes back to just, again, information's much more readily accessible to patients. You know, 20, 30 years ago, the surgeons got somebody in their office talking about fundoplication.
Mhm.
The patient's got nowhere to go when they're at home to figure out what exactly that is. Now there's so much information out there. And I think, yeah, that's raised the expectation. Hey, doc, I appreciate you letting me know I need this. I went home, I read this. I read that there are these possible complications. Can we talk about that? So, yeah, I think that's raised expectations for how much communication and transparency are needed today.
And looking ahead, what would best practice communication after unexpected outcomes ideally look like in the next decade?
I think if there's one shift that I could implement right away, Kevin, it would that we as a profession become less reactionary
Hmm.
and more proactive when it comes to addressing this. I think sometimes doctors are like, I don't know if, should I address this? Hopefully it doesn't come up. Maybe they won't bring it up. I think we need to be more proactive and say, look, you know, this operation I just did, 96.7% of it was great. But let me just let you know, there are a couple things that happened that I want to make you aware of. Not saying it's a problem, but let's just talk about these little things that didn't go exactly as planned. I think we need to become just more proactive on
Hmm.
that. And I think that'll also enhance the trust that our patients and society has in us as physicians.
And my final question, let's end with some take home messages they want to leave with the Kevin MD audience.
Well, I appreciate that. My number one message is, look, I really enjoy being a physician. Yeah, I work full time for an insurance company now. I will always identify as a physician because I'm so proud of that. I'm proud of what it took to become this, and I'm proud of my dedication to my patients. And I think we need to remember that. As long as we just keep our patients at the forefront of everything we do, as long as we draw on that wonderful education we got in medical school and residency, we're going to do the right things. Trust your gut, do what's right for the patient, Don't worry, legally, if you need us, your insurance company will be there. Don't worry about that. Focus on the patient. Things will work out okay.
You've listened to a special sponsored episode from Mag Mutual, exploring how physicians can navigate unexpected medical outcomes while preserving trust with their patients. Find out more at magmutual.com. That's magmutual.com. The link will be in the show notes. William, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Kevin, thank you for your time. Thank you to your audience so much for their time.